It's difficult to follow all the excellent presentations from the morning, but I will do my best. Just to give a brief introduction to what I'll be presenting, today we heard a lot about general factors in lifestyle which can improve your health, which also included diet. And today, what I'll be talking about is what is this healthy diet? We spoke about it could look like a Mediterranean diet, it could look like a vegan diet, but we at the EAT-Lancet Commission came up with scientific targets to see what exactly that would look like. How many fruits and vegetables, how many meat, or how much not to have meat. And this will be more of a practical recommendation-based presentation and not so much on the evidence between health and diet because we went through that in the morning. So I'll just reintroduce myself. I come from two homes. My first home is the EAT-Lancet Commission, and I was a contributing author, and I worked on it for the past 3 years, where, as I said, we came up with scientific targets on what is a healthy diet, and is that sustainable, and can we pull it through to stay within the planetary boundaries where it is also just. I also belong to PAN International, which is my second home, where we then use the translative work. I have my team sitting there. Yes. We partnered with EAT to use the scientific evidence to then translate it for the health sector. And we came up with, we convened a large group of healthcare professionals to then come up with this action brief, which has multiple points on what should we as the healthcare sector do, which can improve health, which can improve sustainability. So basically, one home is generating scientific evidence, the other home is translating it, and I'm very lucky to be part of both. Today, what I'll be presenting is, we'll start with why diet is important, and I'll look at Czech Republic. This is from the Global Burden of Disease, which shows, so you'll see the big boxes are the contribution of that specific disease to mortality or to death. And the dark colored are what proportion of that is due to diet. So most of the mortality is coming from heart disease, and half of those 51% of the cardiovascular diseases is due to unhealthy diets. Now, what does that look like? Most of it is from high sodium, low whole grains, low fruit, and then you have these other aspects. So basically, the underlying thing is, just to reiterate what we heard in the morning, diet is important, even in this country. So what exactly is a healthy diet? What does that look like? What we in the commission did, we synthesized a massive amount of cohort data, randomized trials, randomized controlled trials. We also looked at composition of foods, effect on risk factors, on health. Again, a lot of studies similar to what were presented in the morning. I will not go through that. And we came up with this diet, which is mostly plant-based and mostly whole foods, moderate amount of animal source foods, and quite minimal amount of red meat, and almost none or limited amount of sugar, unsaturated plant oils, where we should basically almost always substitute it with basically refined and saturated food to be substituted with whole foods and unsaturated plant oils. I'll quickly go through what this actually looks like in practice. This would be per day, 5 servings of fruits and vegetables, 1 or 2 servings of nuts, and 2 to 3 servings of legumes. And if we look at animal-based, if it is preferred, because animal food is always substitutable, but fruits and vegetables are not substitutable. But if people prefer meat, the Commission then talks about having moderate amounts of meat, which includes maximum 2 servings of poultry per week, 1 serving of red meat per week, for example, 2 servings of egg. Now, that does not mean that we just have to follow this diet. It basically means that we can make different combinations of this diet and have a variance of different dietary preferences. A flexitarian diet that looks like this, and then you have a vegan diet where you substitute all of the animal source foods with other plant-based sources. For example, the protein will come more from legumes. And this is what the plate would look like. Half of it would be fruits and vegetables, and the grains should almost always be whole grains, because whole grains are a lot more higher in protein, fiber. And clearly, we see that the food, this diet, is not a one-size-fits-all. It is, you can substitute it based on what preference you like. Now, at PAN, what we did was, this is good evidence. Now, what do we do with it? We can't be reading the report every time. All physicians cannot be reading the report. It's like 100 pages, I think. So we came up with a fact sheet which then translates the work into specific recommendations that we can incorporate in our own lives, but also in the healthcare sector. For example, physicians can then use it as dietary recommendations to their patients. And just to go through this very quickly, the fruits and vegetables then come out to be daily minimum 3 servings of vegetables and 2 servings of fruits. And in almost all cohort studies, we see that higher intake of fruits and vegetables was associated with lower risk of non-communicable diseases and total mortality. Similarly, for whole grains, 3 to 6 servings of whole grains, and that could be, say, 1 serving could be half cup cooked brown rice, half cup cooked 100% whole grain pasta. Again, this, when substituted, if you were to have refined grains, all the health gains that you get from whole grains would go away, and that will be associated with higher risk of higher weight gain and other non-communicable diseases. And that's why the Commission recommends only whole grains. We then have legumes, nuts, and seeds, which we've spoken about in detail in the morning. And starchy roots and tubers, I think this might be a little different from what we saw in the morning. I know we spoke in one of the presentations that higher intake of sweet potato was associated with better health outcomes. In the Commission, our work showed that starchy roots can be substituted by whole grains, which would have higher and better health outcomes. And that's why instead of saying maybe no starchy roots, because that's one that's not as healthy, but also it's also a major energy source in a lot of countries, but it needs to be maximum at less than 1 serving per day. Most of the data, most of the evidence for starchy roots and tubers is on potato, and not so much on, I would say, for example, sweet potato. And I know sweet potatoes are a lot more healthier than potatoes. And that's why the Commission the recommendation is based on the evidence that's there on potatoes. Finally, we look at animal-sourced foods, which was a bit of a controversy in the first Commission report, where the media, some sources in the media, termed the Commission as a vegan agenda. And this time, we tried to basically address that miscommunication by saying that, one, again, the PHD, the Planetary Health Diet, which is a healthy and sustainable diet, is not a one-size-fits-all. It includes animal-sourced foods where people prefer it, but that needs to be done in moderation. But there are a lot healthier variations where you substitute the animal source foods with plant-based foods. But if you were to prefer animal source foods, the basic principle that you would use is to have 2 servings of animal sourced foods per day, and 1 should be dairy, if that's what you need to have. And dairy could be 1 cup of milk or like 25 to 30 grams of hard cheese. And the other needs to be only one of poultry, fish, red meat, or eggs, where you limit the red meat to once a week, because red meat is in almost every cohort study associated with higher risk of type 2 diabetes, obesity, cardiovascular diseases, couple of types of cancers, and total mortality. For example, for eggs, you see eggs have a complex relationship with health outcomes. It is definitely a lot healthier than red meat, because you would have the association of eggs with health outcomes, or with association of eggs with higher risk of health outcomes, or NCDs, that would be lower than red meat, but that would be higher than plant-based sources. So if you were to prefer animal-sourced foods, again, you would limit it. But that's not to say that you cannot have 1 egg per day. You would then replace the others by the egg. So this is basically the principle that we work on. Okay, so what does the food consumption in this country look like? The current diet is basically, we have higher red meat, we have higher animal source foods, poultry, especially pork, than what is recommended in the Planetary Health Diet by the EAT-Lancet Commission, and a lot less fruits, vegetables, especially nuts and seeds and legumes, than the Planetary Health Diet. So if we were to eat healthier, we would need to increase our consumption of fruits, vegetables, legumes, nuts and seeds. Our consumption of grains here in this country that's still okay. And definitely reduce animal source foods. Now, what would that look like? What will that do to our health in the country? One of the leading causes of mortality in terms of non-communicable diseases in Czech Republic is cardiovascular disease. And if you were to follow the Planetary Health Diet, our modeling analysis shows that cardiovascular diseases would decrease the percentage of deaths, so would type 2 diabetes. And most of the shift would come through cardiovascular diseases and type 2 diabetes. And why is that? What part of changing this diet would lead to that? So the green part, which is higher consumption of fruits and vegetables, and the red part, lower consumption of red meat and processed meat, is how you get to this change in mortality. Now, these graphs looked very different for India. For India, it was type 2 diabetes and cardiovascular diseases that came up more, and stroke was quite minimal. And we don't eat a lot of red meat or meat in India. So the red part was almost insignificant. The green part existed. And there was another called whole grains, the yellow part. So for each country, the diet shift needs to look different. And it's not just based on country. This is country representative data. It will look different for each one of us based on what kind of food we are having, and also what kind of exact food we are having within the group. Are we only having lettuce, or are we having kale? So what would that look like? We we had a study which looked at diets that are similar to the planetary health diet. For example, the Mediterranean diet. And this was a large cohort study that was followed for a few years. And it looked like, so the deciles, the higher decile means the closer it is adhered to the healthy and sustainable diet, which is similar to the planetary health diet. So the better or the closer you were to the planetary health diet, the lower the mortality was in that population. And a similar analysis then looked at what were to happen if the whole country, if the whole world, in every country, we shift our current diets to the planetary health diet, but keeping in their own preferences of variations. Like I explained, the differences between India and Czech Republic. What would happen then? The premature deaths would decrease by 27%, which is huge. And that would mean negative 15 million deaths per year, a decrease in that, which is around 40,000 deaths per day will be prevented. Now that's a lot of health impact. I think even in the morning, what we summarized was that healthy diet is actually healthy. Plant-based diet is healthy, but is this diet anything good for the environment? But first we can look at what diets do for the environment currently. This is a complicated graph. I'll explain. So these are what we call as the planetary boundaries. For example, I'm sure you'll be familiar with climate change. There's only this specific budget of carbon dioxide that the Earth, our planet, can actually survive. And there are multiple other components of planetary boundaries. We don't need to go into detail. What we need to see is the yellow part is what it is, what's a safe boundary. And the orange is a high-risk line. And we have transgressed almost every of those, which means we are in not a good situation in terms of environment. Now, where do our diets come here? We know diets form a big part of environmental impact, but how much? So the brighter blue is what shows the food system contribution to transgressing planetary boundaries. So if we were to shift our diets to something that looks like the table I presented, what would that do to the environment? Will it make it worse? Will it make it better? It will make it better. Now this is again for Czech Republic, and the flexitarian diet is basically what we saw in the table with moderate amounts of animal source foods. The pescatarian is you replace poultry and red meat with fish, and vegetarian is you replace all of that with plant-based, but you still keep dairy, and vegan is completely plant-based. So the more plant-based you go, the lower emissions that would result in. So this diet is not just good for health, it's also good for the environment. Then there is this another analysis that comes on if it's good for the environment and the environment is also good for the health, then that improves our health even better in an indirect sense. I will not go through that. We then looked at a projection scenario. What happens in 2050 with our planetary boundaries? So land for agriculture, GHG emissions, water use, and that's just like basically based on pesticide use. The higher, the worse. The lower, the better. What BAU is business as usual. If we were to go to 2050 based on what we're eating right now, our environmental impact is going to increase logically. The population is going to increase, food demand will increase. But what happens if we shift our diets to the EAT-Lancet diet or the planetary health diet? The emissions for some the emissions actually not just decrease from what it would have been, it will decrease based on what we are emitting right now. And for a couple of other planetary boundaries, it would decrease based on what it could. So we see that that environmental impacts would improve for a lot of factors, but a lot more for example, for GHG emissions. And if we were to then bundle this up with mitigation factors like agriculture productivity and reducing food loss and waste, we almost, for most of these, we reduce it lower than what we are currently, what our current impacts are. So basically, diet for the planet is very important, but so are these other measures. It needs to be a bundle. But even if it weren't, it will still help. This is just to show how, basically, this is just to show that the planetary health diet has multiple variations. It can look like a Mediterranean diet. It could even look like an Indian diet when appropriate foods are substituted. For example, we eat a lot of refined grains. If we were to shift that to whole grains, and if we were to reduce that and increase our legume and vegetable consumption, we come to a healthy diet. Finally, if you wanted to look at all the data that was there, and if you wanted to look at the specific recommendations to incorporate into your own life, into your own diet, but also to use it to basically to be friends of your friends and have a positive social impact, and for physicians to also recommend it to their patients, we have multiple resources where we have a physician fact sheet, basically summarizes everything that I presented and a little more. And then we also have the action brief, which Roberta and Nanine here also worked on with the EAT-Lancet Commission, where we look at what are the practices, what are the actions we need to, as a healthcare sector, we need to follow, and what are the actions we need to stop. I won't go into detail for that. If you have questions, please go to Roberta. She's at the back very conveniently. And finally, we also have a nice report finding summary. And these are all available on PANCO, our online learning platform. And if you would like a link to all of that, you can just scan the QR code. And there'll be multiple links you can just click on. And finally, I think earlier this week, we had a briefing session for the healthcare sector on the EAT-Lancet Commission, which was, the main speaker was the co-chair of the commission. So again, these are all resources. We also have the recording on PANCO. All right. Thank you. If you have any questions, you can send them to me, ask me, and we have our team who's also worked on this. Thank you.